The eye area can be one of the first places in the face to really show those very subtle first signs of aging. And there's quite a few things we can do in clinic. I guess to start with, we would talk about skincare and to have a decent eye cream that may have a little bit of retinol in it, but might also just be peptide based, something to hydrate that skin and stimulate the skin to produce more collagen and elastin. Depending on how your eye appears, there might be multiple things that you are concerned by. Sometimes people worry about those fine lines and wrinkles and the skin becoming crepey underneath their eyes. Sometimes they might be worried about dark circles, which might be to do with a pigmentation problem in the skin, but might also be to do with the fact the skin is thinning, and by the skin thinning we can see the muscle of the eye underneath it. So sometimes it's a pigmentation problem and sometimes it's a thinner skin problem. A good assessment's always useful in that way. But once you've come in, we might suggest a few things. In general, most eyes can take a bit of polynucleotides. So that is fractionated DNA directed from salmon and trout, and we inject it underneath the eye. That is an amazingly powerful thing for around the eye. It's got an antioxidant effect, it's got an anti-inflammatory effect, but the polynucleotides themselves tell the skin cells to really produce more collagen and elastin and thicken and hydrate the skin in a really noticeable way. I've seen some wonderful results in clinic. Sometimes you might also have a hollowing of the eye. So as we age, everything in our face changes. Our skull bones, our eye sockets even get bigger. So if you imagine as the bones around our eyes are getting bigger, that's allowing the soft tissue of our eyes less support, and it's really affecting the ability of that muscle to stay supported. That can sometimes result in bags under the eyes where fat protrudes over the eyes, and sometimes that might be that we say, I'd recommend a good surgeon and send you that way. But sometimes also there's a hollowing of the eyes. If there's a little bit of a hollowing of the eyes, what we call here is the tear trough area, and a really well placed bit of dermal filler can help soften that transition from the bony area to the soft eyelid, which can be really effective in some eyes, but it's not for every eye, and it's really worth to have a consultation just so we can talk you through it.